Hi everybody, my name is Cody Stemple, and I'll be presenting the comparison of absolute and relative ventricular dimensions between elite male and female swimmers. I want to start by bringing up the idea of the athlete's heart, and what that's referring to is the electrical, structural, and functional changes that are brought on by intensive and chronic exercise, aka sports. We also know that female athletes' hearts differ from male athletes in a few aspects. Previous studies found that females had lower absolute values of left ventricular dimensions, things like mass, diameter, and wall thickness, but when the dimensions are scaled to body surface area, they're similar or even higher in females. Granted, most of this research is done in land-based athletes. Another thing we know is that cardiac adaptations are sport-specific, and the way we train has an impact on how the heart changes. Like I just mentioned, most of the current research has been done in land-based athletes, and aquatic-based athletes have different physiological and cardiovascular demands, and aquatic-based findings are under-researched in comparison. The purpose of this study is to determine if there are sex differences in absolute and relative left ventricular dimensions in elite swimmers. We hypothesized that males would show greater absolute values of left ventricular dimensions, and when indexed to body surface area, females would show similar or greater values of indexed left ventricular dimensions. Participants were recruited at the 2019 FINA World Championships. 39 males and 26 females were recruited, and there were no significant differences in their age. Demographics and training volumes were recorded with a questionnaire, height and weight was measured, and body surface area was calculated. An echocardiogram was done with standard views after 10 minutes of rest, and the images were analyzed offline to determine absolute left ventricular mass, internal diameters during diastole and systole, and relative wall thickness. Relative dimensions indexed to body surface area were then calculated. Independent t-tests and Mann-Whitney U tests were performed on normally and non-normally distributed data to determine if there are any sex differences. In this figure, you can see the mean hours spent training for each training type per week between males and females. Looking at the first two categories, which are swimming hours and land-based aerobic training hours, you can see that there were no significant differences between males and females. When you look at that third category, which is land-based resistance training, you can see that males did engage in more resistance training compared to females. 3.9 hours per week in males compared to 2.7 hours in females. Table 1 shows you the recorded echo measures. In the first three rows, I have the absolute values for left ventricular, internal diameters, and mass, where males showed higher absolute dimensions. The next three rows show the relative dimensions, where they were actually similar between both sexes. Using each participant's relative wall thickness and left ventricular mass index, we characterize their left ventricular remodeling, according to this reference illustrated on the left. On the right is a table of the prevalence of eccentric and concentric remodeling in both male and female athletes. As you can see, females had they had more eccentric remodeling, which is characterized by normal relative wall thickness, but greater than normal left ventricular mass index. While males had more concentric remodeling, which is characterized by normal left ventricular mass index, but greater than normal relative wall thickness. So the main takeaways from this study were that normalizing to body size eliminated sex differences in left ventricular dimensions. Eccentric hypertrophy was more common in female athletes, which is consistent with previous findings. Increased concentric hypertrophy in males may be attributed to the larger volume of land-based resistance training. Finally, our study was the first to demonstrate this in a swimmer-exclusive sample, and our findings align with observations in land-based athletes and suggest that swimming provides a similar training stimulus in male and female athletes. As for some limitations, these results may not be generalizable to non-elite athletes since our participants were elite-level swimmers. Some participants were not able to be recorded for all the echo parameters, which reduces the sample size in certain measurements. And training was not the same between males and females, because males participated in more land-based resistance training. Future research should aim to make a focused comparison of echocardiography in both land-based and aquatic-based athletes of elite and non-elite status. Thank you for listening.